Right, so if you have read and understood, considering its communication station, kindly begin.
Hello, my name is Dr. Karma. I am one of the orthopedic trainees covering for my consultant. May I confirm your name and age, please?
Yeah, I'm Dafur, 32 years old.
Okay, Mr. Dafar. I've been asked to talk to you about the procedure that you have come for today.
Yeah, it is my turn. It is my turn now for operation.
Unfortunately, Mr. Dafar, my consultant has to attend the emergency case, and we are sorry to say that we will not be able to carry out your case today.
What do you mean? What do you mean by that? It's my case. You neglect my case, and it's not emergency. Why do that?
Again, please have a seat, Mr. Dafar. I again apologize for that. I can understand that your knee is giving a lot of problem to you, and from your notes I see that it has been cancelled twice in before, and again has to be postponed today. And I can understand your frustration, but surgical emergencies has to be prioritized, and that's why our consultant has to attend that emergency. I'm really sorry for that.
So you can call Can you call him for me, please? I want to speak for him about my condition. I'm frustrated. I'm on pain.
Yes, Mr. Dafar, we can understand. I can understand your condition, but I'm so sorry. I cannot call him because he's in the emergency operation, and he will not be able to respond to my call.
So can you do this for me? Can you do operation for me?
Sorry, but I am not authorized to do such operations without the supervision.
So if your consultant is busy with the emergency, and he postponed me 2 times, and you are not authorized, I need another surgeon.
Yes, Mr. Dafar, it is your right to choose choose your doctor, but I'm afraid that it will be time consuming for you, because going for a new consultant, you have to start, the new consultant has to start seeing your case right from the beginning, and it will be time consuming for you.
So what shall I would do? So give me now appointment, fix appointment, and you promise me you didn't postpone this one.
Yes, I'm so sorry, but I cannot give you a date at the moment. But yes, we will call you once we have the date for you. Once we put the date for you, and I assure you that I will mention your condition and your circumstances, and also that it has been cancelled twice before, and we will try to emphasize and give you a date as soon as possible.
Doctor, I'm suffering. I'm on pain. I cannot work. How can I work now?
I'm so sorry. I do understand. I do understand your condition. Regarding your work, I can write to your employer and ask him to extend your leave, explaining your conditions, and also the operation being cancelled today as well. And if you need, I can also make a call to him explaining your condition.
So can I walk on my leg, because I'm afraid from that. I feel it is more hurt or more problem for leg. So can I walk or not?
It is better to remain active, but with non-weight bearing exercises. And yes,
Yeah.
there will be some tears and wears, and better to practice some exercises like non-weight bearing exercises like swimming and all. And if you require, I can also refer you to a physiotherapist, and he or she can suggest you some exercises which will strengthen the muscles around your knee and keep your knee strong.
Okay, I need that, but I have this severe pain, and this medication it does not affect. So can you prescribe me another?
Yes, Mr. Dafar. I will prescribe a different painkiller for you, and you can stop the one you're having right now, and we can give you another painkiller. Again, please, I understand your condition. I'm so sorry for that. Please accept my sincerest apologies.
Yeah. Okay.
So, Mr. Dafar,
but I hope they didn't postpone it again, please.
we'll try our best, Mr. Dafar, but in case such emergencies come up, then we have to prioritize the cases.
Okay, I understand that. Yeah.
So, do you have any other queries, Mr. Dafar?
No, thank you.
Okay, thank you
Did
so
you
much.
offer to
So
write
let
the
me
letter?
summarize.
Yes.
Let me summarize.
Yeah.
Summarize what we have been through today. You have come for your knee operation today, and it has been postponed twice in the past, and even today, it is going to be postponed due to because my consultant has been engaged with another emergency case, but yeah, we are there to help you anytime. And if you have any query or want to reach to us, please don't hesitate. I will drop my number with the nurses here, and for you can have from her. Thank you for understanding, Mr. Dafar.
Thank you very much.
No, but then patient is not happy. Patient will still insist in complaining.
Oh, okay.
And
Because
candidate will explain, okay, you would have to fill a form. I'll make sure you get that and you can launch your complaint. It's called PALS. What is the abbreviation of PALS? This abbreviation stands for what? 10 seconds you have left.
okay,
Yeah.
Patient, yes?
patient advice,
Patient advice and license service.
Yes.
yes.
Okay. Yes, give feedback, please. At the end, patient will still complain. And this is like angry patient, not cooperative, frustrated.
Yeah.
And because his 10 seconds were left, patient was continuously accusing that my problem is not emergency, it's not prioritized, and other patients are, their emergencies are prioritized. So that's not fair. So anyone want to give feedback to Dr. Kalma?
Yes.
Yes, please.
Can I start?
Yes, please.
He's well prepared.
Yes.
He's more confident than 2 days before. He
Yes.
started to put her elephant feet in the communication stage.
True.
Yeah, like the elephant feet, like the surgeon, elephant feet.
Yes.
He started very well.
Yes.
I just want to add some small, tiny points for him. So, firstly, when I came, hello, I'm Dr. Dafar, one of the surgical doctor. Are you Mr. Smith, for example? Are you Mr. Smith? Yes, I am. And then start to conversate. You didn't want to confirm your name and date of birth because the order you going to add someone. Just, are you Mr. Flan? Are you Mr. Smith? Yes, I am. And continue. This is one. And the other point, you repeated more. I'm so sorry. I'm so sorry. You said about 6 times. You can change. That's all. But
Okay.
need to be
How,
a little bit
give
changed.
Dr. Duffer, kindly give example how you wanted him to change.
Okay, so if he said, I'm struggling, I'm concerned.
Sorry, you got muted.
I'm sorry, I just finished. Okay. Hey, so he can say like that. If he's say, I'm on pain, I can imagine how it's hard for you. We postponed you 2 times. Yes, I can imagine that. How to be, how can I, so for if he said, how can I work? I know, I can imagine how it is important to work, but your knee, it is hurted. We need to more effort for yeah, like that. He can choose according to the situation.
Okay.
Yes, Dr.
Because
Said, you raised hand.
because sometimes especially angry patient, if you told him, I understand, so the next answer from him is, how you can understand that?
Exactly, to emphasize on Dr. Daffer's point, well, we can use synonyms of sorry, like I apologize, my deepest apologies, extremely sorry. And when a patient tells I'm unable to work, we can always tell, I empathize with you, I understand the problem, I'm really very sorry for this condition, and he will provide a letter for you. So in this condition, we're probably changing the monotony of the speech.
Yes.
That's the only.
It's very important.
With practice, he'll do it because English is not his first language, if you can understand. And then talking once in a language which is not your mother language, or you're not even used to speaking in that language, so it becomes little hesitant and little so what I felt when I listened to his he was like, because English is not his first language, so he was little reluctant and little hesitant, that's all.
Ma'am, actually the presentation was extraordinarily good.
It was good, yes.
Actually, this is an extraordinary, very good presentation.
But
there was nothing to be negating the patient at all. I mean, even if he presents even with sorry, there's nothing to negate it. He did a very good presentation, actually. He summed up everything, he summarized everything. It is just as an additional basis beyond this, whatever is to be done. That's all.
Yes, like you are saying.
Thank you.
In like you are saying that in what like patient could have he could have changed strategy, in that sense I'm saying, because he's not used to using so many different vocabularies. If he was in that situation where he was using English as a routine language every day, then he would have come up with different words and different scenarios. Like, he doesn't have to say sorry to be sorry all the time. You can say, oh yes, I can really imagine how problematic that is for you, and you can like change a word and you can still be the sorry, and you can still show sympathy without using the word sorry, if you understand what I mean. That was all. But if you'll be little bit more confident, like bring the tone in your voice that you're more confident, you're the boss, you're the decision making authority, then your way of conveying or saying will change. That's all. Otherwise it was very good. You covered everything nicely. Good.
Ma'am, I just have a small question. In a situation that we are extremely nervous and we are not able to come up with any other words or any other things of that sort, he did cover all the points which were supposed to be covered, if I'm not wrong. This will not be a negative point, as in it will not be a negative point of the examination, will it?
No. What they will only look at, because there'll be two examiners, one will be looking at your knowledge part, how well you're conveying your message. Other examiner will be looking at how well communicative you are, how good you can communicate. Like even with this one, he has passed because he covered all the essential points of the statement. And even if you're just saying sorry, because they understand. It is sorry. So it is fast. Yes, Dr.
So in this situation, he said a good question, and you brilliant answer. I can add something for that. In this station, we have a 12 mark for communication. So a non-doctor, he is looking how to act. If you did well in the in knowledge, you get just four mark, and you can get 9 mark for extra if you are professional. But we need to take 12 mark in the communication. This is what is important. The important thing is how to know the measuring of the marking scheme. So in this situation, don't forget to focus more on communication, because we need to take a high mark, 12 mark from the communication.
Thank you, Dr. Tafa.
True.
Yeah. Thank you, ma'am.
Here is your question.